So normally for narrative synthesis also there are guidelines as to how to present a narrative synthesis. So here it says if studies are very heterogeneous, it may be most appropriate to summarize the data narratively and not attempt to meta-analytic. Right. Okay. Now describe the dissemination plan. Now we are coming to the end of the protocol. Presenting results. Then you have to mention in the protocol all these, right? How you are going to do that. And also here, describe how to deal with protocol amendments during the review. That is important. Now, as I said, actually, now when you are conducting the systematic review, now we have the protocol set before, right? And now we are following the protocol. But when you do it, now we'll have to amend some of these, okay, due to various reasons. So now that is understood actually. Now it says, describe how to deal with those protocol amendments during the review. Okay, so that means now you'll have to, in the protocol, you have to say how you are going to do that. Okay. If you are doing it, why you are doing it another way than the protocol, and why and what you are doing and all that you'll have to explain. Okay, and then now it is describing archive review data material. Okay, documenting the review, as I said, save all the search strategies. Now there will be a lot of search strategies. I will show you. I think I will have some time to show you those. So there will be several search strategies. So you'll have to, now for different databases, there will be different search strategies. Okay, so all those have to be documented. Then flow diagram of the study selection process. That is important actually. Now flow diagram of the study selection process means now we start from a large number after the literature review. So you start from 1,000 odd articles, and then you go on filtering. Now you should have a flow diagram showing how the filtering is done until the end of the quality assurance. The number of articles that you are using is this for the review. Okay, so there should be a flow diagram. And then records of search asserts and search strategies. Then exclusion, inclusion criteria. And also you need to have the reports of quality assurance. Now, quality assessment you will be doing for articles including the study. So you should have the results of those reports. Okay. And then data summary table. Data summary table is the table that you are doing during the extraction. You extract data into a table. So we call it data summary table. So I'll be showing all that, right? Data summary table. And okay, keep clear paper and electronic records of your searches, quality assessment decisions, and data extraction. Now all this is why you need all those, so that it can be repeated if necessary. Okay. Right. So now we are at the end of protocol. Now we are back in the procedure now. Now item number 2 was the creating protocol, and number 3, phase 3 is conduct the review, follow the protocol. Now there were 8 steps. You follow all those steps, okay, when you conduct it. And then 4th step, reporting the review and dissemination, update the review as needed, rerun search for review update. Okay, so that's the procedure. Okay, right. Now, why update the review? Okay, this is why. New research findings can quickly make SRs out of date. I think I understood, right? So that can happen. So that is why you need to update the review. Okay. Now here it says the Cochrane collaboration policy is that Cochrane intervention reviews should either be updated within 2 years or include a commentary to explain why this is not the case. Okay, because now all these reviews are published in the Cochrane library, Cochrane reviews. Okay, so because of that, now either you'll have to update the review and send the report, or else if it is not, then include a commentary to explain why this is not done. Then why search gray literature? Now these are some notes. Now I'm trying to go through some notes, right? About the items, about the things that we explain, some notes. So why search gray literature? That is to reduce publication bias, reporting bias, increase currency of results. Conference papers are most current. Okay? And then also to include global literature. Then provide unpublished trial data. Okay, so that is why you need to do gray literature use. Right, what is publication bias? That means now not all the completed studies are published. That means there are a lot of completed studies which are not published. Okay, now mainly, now this occurs when authors are more likely to submit or editors accept positive results versus null results. Okay, so and also publishing results were 3 times greater if the results were significant. Okay, so such publication bias was found for both clinical trials and observational studies. So because of that reason, actually, now we have to avoid publication bias during a systematic review. Now, what is reporting bias? Positive versus negative. Normally mainly the positive results are published. Okay, and also selective outcome reporting. Now, when during a research study, there will be several outcomes. Okay, but sometimes only the very significant outcomes are reported, and some outcomes are neglected. So it is selective outcome reporting. Okay, it is a kind of reporting bias. Only the significant outcomes are reported, but non-significant, maybe those outcomes also may be important, but it is not reported. Okay, and then reporting bias include language also and time lag. Okay, speed of publication depends on direction or strength. Yeah, okay, right. And citations also is a reporting. It also includes in the reporting bias, because positive results are cited more than negative results ones. Again, positive versus negative here, right? Okay. Right. Now, if you want to look for negative results, now there are journals. Right. If you want to look for negative results, here, Journal of Negative Results in Biomedicine. So you can check whether there are any negative results are published. Okay. And other negative results periodicals. These are the line websites. Okay, right. So now again, some notes on this quality assurance thing. Now, I thought to provide you with some terminology, idea on terminology used in study quality assessment, right? Now, now see, according to this, this is the NHS UK guidance, National Health Sciences UK guidance for QA of research results, right? The degree to which a study employs measures to minimize biases, focusing on internal validity, a set of parameters in the design and conduct of a study that reflects the validity of the outcome, related to the external and internal validity and the statistical model used. So That's how the quality defines. Okay, so when you say bias, now bias, systematic errors, a tendency to produce results that depart systematically from the true results. Okay, now when there are bias, the outcome results may be overestimated or underestimated. Okay, so unbiased results are internally valid, because biased results are, as I said, overestimated or underestimated, and which is not true. Right. So internal validity, the degree to which the results of a study are likely to approximate the truth. It is a prerequisite for external validity. Again, the external validity, generalizability or the applicability, the extent to which the effects observed in a study are applicable outside the study. Right. However, now finally, the quality there, when you make a judgment on the quality, carefully consider and assess all the factors that may influence the quality of the evidence. So you'll have to consider all the factors. Okay. And bear in mind that down and upgrading for specific quality factors should be done in the context of all the factors that influence the quality of the evidence. Okay. So at the end, it is the strength versus the weakness of the quality, the entire study. Right. Okay. Now here are some URLs for guidance. I mean, you can look for guidance on completing SRs. Now, some of the things I was talking about were from these guides. Okay, CRD guide, Cochrane handbook, Cochrane methods group, all these. So you can have access to all these. Okay, those are guidelines. And now some published tools for assessing quality. Assessing studies. Okay, one is Newcastle Ottawa Quality Assessment Scale, available for various types of study designs. NOS, you call it NOS quality, NOS scales. Okay, and then again NIH, National Institute of Health USA tools, that is also available for various types of study designs. And then CRD guidance for undertaking reviews in healthcare, that they also have their tools. And the Downs and Black instrument, Cochrane handbook, then GRADE, an organization called GRADE, they also provide assessment tools. This is another one. Okay. And as I said, reporting guidance is normally the PRISMA, or if it is a meta-analysis, then MOOS. Then publications like registration of Prospero. Right. This is another guidance plus reporting guidelines. Right. Okay. Now, this is what I was talking about, the flow diagram of the study selection process. Flow diagram. This is one example here. In this case, actually, it starts from 496 articles. Potentially relevant titles identified after initial search of databases. And duplicates, how many duplicates? Then after removing those duplicates, this much. And then studies excluded, not meeting the inclusion criteria. Then potentially relevant abstract reviewed. After abstract review, this much. Then after excluded, not meeting the inclusion criteria again, after going through the abstract, again this much. Then they have gone through the full text articles, and then again removed some. And then Right. Now, it is the details are given, how many were removed and all that, right? And this is studies excluded not meeting the inclusion criteria again. I mean, they have given all the details there. And then relevant studies included in the systematic review. Finally, it's 5. Right. So this is one example of a flow diagram. So you need to have a flow diagram documented. And this one is a sample form for inclusion exclusion. Actually, you don't have to have this way if you are using Ryan. Okay, right. And actually now in our country, to do a search, the PubMed is the database that we will be using because it is available free of charge. It is by the National Library of Medicine. I think you all know, right? The faculty members. You should know about PubMed, right?
Yes, madam.
Right. Actually, PubMed is a very useful database. It is the largest database in the world for biomedical sciences. Luckily, we are fortunate that it is available free of charge, and it is not only a database. It has a very powerful searching tool. It has a lot of features, a lot of facilities, powerful searching tool. Actually, I can talk about a lot about PubMed, right? When you do a systematic review, it is a must that your main search is done through PubMed. Now, when you submit a systematic review article to a journal, they want the search strategy at least for one database. Okay, so this is the database that we should have for that purpose. So we can create the search strategy through PubMed to be submitted. Okay, so actually I do workshops on PubMed also. Because I can talk a lot about PubMed. There are so many things that have to be talked about, and it is a very very good facility that the medical professionals have in this country, so they should be using this. So I have been doing workshops on PubMed for various groups actually, right? So the PubMed is the database that we are going to use first. That is the only thing actually we can get all the details from, right, when you do a systematic review, right? And now this is Ryan. I will just show you the Ryan. This is the first page of Ryan. Okay, you can sign in, and then I think if time permits, now there are some things that I want to show. If the time permits, I can just show you this. This is just the first page of Ryan. And this is Mendeley. Mendeley, actually you need to have Mendeley or EndNote to store all your references, and then to have subgroups, and you can categorize, and you can manage all the references through that kind of a reference management system. So you need to have one when you do a systematic review, right? And also now this is another URL I want to show you. I think you all can go to this URL and see what is available there. Now it is the Systematic Review Data Repository, a public repository of study data. Okay, and easy to use web-based tool for conducting systematic reviews, which was recently launched. Okay, the recently means now it is about 2015, right? And it serves as a tool for extracting and storing information from studies. An open and searchable archive of key questions. Actually, now I haven't used this. I tried to use it, but yeah, it was not available when I tried it. But now it seems now when you extract data, you can do it through this URL, because they have a system you can upload the articles from the database straight away to this URL from PubMed or Scopus, and then from there the system will extract data for you. So which is going to be very handy. Okay. So actually I haven't tried it. I want to try it, but I couldn't still do it, right? If I can use, if I can try it and it's easy to use, then I can actually make available the details of how to do it also through Shanta when I find it. Okay. So now it says here that one, downloading study information from PubMed automatically, and then quickly creating complex extraction forms which can accommodate any study design or research question via the form design tools, powerful and flexible question builder capability. Now see, so it's going to be very handy, enabling easy comparison and reconciliation of double data extraction. So it is a very useful one. Only thing is I couldn't learn it yet. Right. Okay, so that is the URL. I think this is a, in your handout. Right. So now I will show you sample of SR, all that. I mean, there are some documents that I want to show you, which would explain what we were talking about. Okay. Right. So I will now go out from the PowerPoint.